Hello, Alex Wilson here, accredited mental health social worker and owner of Mindful Recovery Services on the beautiful central coast of New South Wales. I wanted to make a little video about something that's been coming up in my practice lately, and also with some of the clinicians that I supervise, and that is this theme of helplessness and hopelessness. Okay, so often I'll see clients who have maybe tried lots of different types of therapy before. Maybe they've read a ton of self-help books. Maybe they've even, had psychiatric admissions, had contact with the mental health teams in the area, or, lots of different, attempted interventions to try and change things, move themselves forward, feel better in their lives and within themselves, but nothing really has worked and they feel really stuck. And so often I'll see clients like this who, maybe they've been seeking help for a couple of years. They may still be very young, but they've come to a place where they feel like nothing is going to work for them. And so they come into my office and they basically say, Alex, look, there's nothing you can tell me that I don't already know. There's nothing you can teach me that I haven't already tried. Nothing works for me. I'm just, I'm broken. There's something wrong with me. There's something wrong with my brain. And that's just how it is, and nothing's going to work, right? And I see people in these situations, and it's really difficult as a therapist to, be able to figure out what to do, because, I don't want to insult the client by suggesting that they haven't tried different things before. They probably have. I don't think anybody, chooses to feel horrible for weeks and months and years on end. But I also know through my experience working in this field over the last 16, 17 years, is that even clients who have come to this very helpless, hopeless place can get better. And particularly with DBT therapy, so dialectical behavioral therapy, which is the type of therapy that I specialize in and my private practice Mindful Recovery Services are really known for. That's sort of our niche area. And so DBT works very well with, people that feel very stuck, people that feel like nothing is going to work for them. Often in sessions, the way this will play out is that, the client might be coming, session after session, week after week, month after month, and nothing's really shifting. They feel like they can't try the skills because they're not going to work, or there's various reasons why they can't try the skills, or they feel that they're not working, and we sort of feel this sort of stuckness together. The good thing about DBT is that we really acknowledge that ambivalence and stuckness are a really normal, understandable part of the process. We don't we don't see ambivalence as a deal breaker. We don't believe that you have to be 100% committed to change in order to get benefits from therapy. You just have to be willing to show up, right? And we can work with the rest of it. And so in DBT, we work very much with the ambivalence, and we explore that, and we notice how we get in, two minds about wanting change. Part of us really wants change, right? We're desperately unhappy and things have to change. And the other part of us resists change. Says, absolutely no way, no how am I going to do the things that might be required for me to get change, because it feels too difficult, it's too much effort, and there's no guarantee it's going to work. Right? So there are these competing parts of us that, we can get stuck in, but in DBT we work with that. So if you are a person who has felt stuck or is feeling stuck in your change process, maybe in therapy, or, maybe just feeling stuck in life generally, if you have a loved one who you notice is feeling stuck, and maybe you're kind of tearing your hair out of not quite sure what to do, you're trying to encourage them, but that's not working, and or if you're a therapist and you've got a client who you're like, it's just not happening, I'm not sure what to do, then what I'm going to talk about is this intensive 12-week DBT group program that myself and my colleagues at Mindful Recovery are going to be running in February 2020. And this is an excellent program for clients who feel stuck or chronically hopeless, helpless, or might be ambivalent about change. And this program is really, really great because it allows clients, particularly who present with this sort of learned helplessness or this real history of, what we might call treatment resistance, which I don't believe in. I just believe they haven't found the right treatment yet. But these clients who, we feel like, oh, nothing's working and we're struggling and they're stuck and we're stuck and we're out of ideas. A DBT program like this intensive 12-week program, is perfect for these clients because that intensity really allows them to shift, right? You cannot sit in a 12-week DBT program and not do anything, right? It gets so uncomfortable because you're constantly being called on it, constantly being reminded, constantly being lovingly pushed towards, okay, let's look at the ambivalence, let's work with that, let's just scoot a little bit this way. What would middle ground look like? What skills are we trying? How can we get more willing, right? So the 12-week program includes a 2-hour weekly group where we do skills training. This is not the kind of group where we sit around and encourage everyone to talk about their feelings and their personal story. It is a skills teaching and learning educational process. It's a weekly session for 2 hours. Every client then does a 1 hour or a 50-minute rather individual session with a DBT therapist. And there they talk about, what's been happening through the week, what's been happening life-wise, where they're struggling with skills. If they're struggling with ambivalence, we work on that. If there's problem behaviors like self-harm and things going on, we work with that. So that's individual therapy. And then they have access to 24/7 phone coaching with DBT therapists. So we usually do that via text, and they can basically text any time of the day or night. It doesn't mean we're always going to reply right away, but we make a commitment. We will get back to them within a period of time. And if they're struggling to use skills or something's coming up, we prompt them on how to use the skills when they're in the situation. And this is a really core part of DBT that makes it different, is that we acknowledge that what's taught in the therapy room doesn't necessarily translate into day-to-day practice, and that's where phone coaching comes in. I offer phone coaching to all of my individual DBT clients, but only some of them use it. The ones that do get better much, much quicker. So it's a game changer. So we'll be asking all of the participants in the group to use phone coaching, and if they don't, we'll be asking them why. So we've got this 12-week intensive program. We're going to cover all the DBT skills: emotion regulation, distress tolerance, interpersonal effectiveness skills, mindfulness skills, in this really lovely intensive time. So if you know people, if you're somebody who does feel stuck and has felt very helpless for a long time, get in touch and consider this program. It will really move you forward very quickly. You can achieve in this program in 12 weeks what you could achieve in individual therapy with a DBT therapist maybe in a year if you're lucky. So it's a really great investment, a really way to get quick results. Now that doesn't mean that things stop after the 12 weeks. They would probably recommend some ongoing work. However, it's a really great way to create some change and then to build on that. So if you're someone like that, get in touch, mindfulrecovery.com.au, and you'll see in our news a link to get some more information about the DBT program, and we can send you an info pack. If you know somebody in your family, if you have a loved one, it's looking like our group in 2020 will very much be around teenagers and young people, although older people are welcome as well. We are capped at 10 though, so and we have a special offer for anybody who secures their spot before the 15th of January. You get your own special DBT binder. You get a few extra resources, some different questionnaires, handouts, skills training modules to work on before the group starts, and you get a free copy of my ebook, Surviving Emotional Crises. So that's your little added bonus if you get in before the 15th of January. We have payment plans available. We do have discounts for upfront payments as well. And we can also run you through all the information about rebates and things like that to make it as easy for you as possible. So if you've been struggling, if someone you know has been struggling, don't struggle anymore. Get in touch. Do this program. It will really, really change your life in a meaningful way. All right, guys, as always, get in touch with me if you've got questions, comments. I'll chat to you later. Bye.